You're listening to the WCEG Network on WCEGTalkRadio.com. And this show is called For Your Good. Like us on Facebook, where we are streaming live. Follow us on Twitter. Follow us on Instagram. And now you can look at us on YouTube Live TV, WCEG Network. I'm Myrna Taylor Ransom, and my guests today, our medical experts, are Dr. Charles So, who is a medical doctor at the Morehouse School of Medicine.
Hi, good afternoon, Myrna. Happy to
And
be here.
thank you. And also our traveling nurse, Pamela Davis, is with us today.
Good afternoon.
Spring has sprung, and so has allergy season. Lots of stuff to keep us stopped up and sneezing, and we'll talk about them in our first hour. Then we will address colorectal cancer. That's cancer of the rectum and colon, because March is Colorectal Cancer Month. So we will talk about that. We'll address those causes and what we can do, the treatment and those kinds of things. Medical experts, thank you so much for joining us. Let's jump right in on the allergy season. It's so beautiful outside. Beautiful day. But I understand that the allergens today are oak, pine, sweet gum, so forth, so on. Anyway, it's problematic for us that are allergic to this, all of the pollen that's in the air.
I say pass me the tissue. I don't know what's out there, but it's on me.
It's bad today.
Yes.
It's like over around 500 today, the pollen count.
Yes, it's your you have your immune system that react to those particles that are in the air, and when you start breathing, and it goes mostly through your nose.
Yes.
And that's how, if you are allergic to it, that's how you start having those reactions.
But I understand that actually, even if you're not allergic to different pollens in the air, that you will eventually become sensitive to it.
Not necessarily. Some people are not allergic or do not have, because really what is important is, do you have symptoms or not? Because what makes you miserable, those are the symptoms, is being sneezing, feeling congested, coughing, having your sinus kind of engorged, full, and also having this headache, trouble sleeping also. All this is the symptoms that make you miserable. That's what is really important. And really, when you have those, what we call this allergic rhinitis, that's what we're trying to control. Is trying to control those symptoms. It's difficult to cure, but really is the symptom control that's the most important. So you can have a better life.
Most people feel like they're catching a cold when you're allergic to something. You start the sneezing and the wheezing. Are there any other symptoms?
The big difference between cold and allergic rhinitis, the cold is due most of the time to viruses. And when you catch the virus, you have kind of a little bit similar symptoms, which is this congestions, this headache. But on top of it, you might have some fever too at the same time. But the cold, what is good in the cold is just a virus. If you drink plenty of water, plenty of fluid, and get some rest, drink some honey and drink a lot of tea, and keep yourself well hydrated, it goes away. But unfortunately for this allergic rhinitis, it's not going away because the allergen, what is responsible for you having those symptoms, is still present.
Yeah,
and it's not going away like cold. Cold, usually after a few days, you start getting better. After a week, you're almost fine. After 2 weeks, it's gone.
I tell you, and it'll start maybe in my head, and with the headache, and then the sneezing. But then last week, I even got a little wheezing in, I guess.
Yes, because Asthma and allergic rhinitis, they kind of sometimes go together. People that have asthma, they already react, which is because you have asthma because you have your tightness in your airway due to this allergen, because you're allergic to something. So you have your airway that being tight. And if you have allergic rhinitis at the same time, it can trigger your asthma. So that's people that have allergic rhinitis, asthma, and eczema at the same time.
Eczema too?
Yes, eczema, because everything is due to this allergen, because you're allergic to something. That's why your skin is reacting. So allergic rhinitis, asthma, eczema, they go together.
I did not know that. Did you know that, Nurse?
I actually knew that, and that's probably why they mentioned a lot on the newscast. If you have breathing problems, try to stay out the air if possible, and wear a mask. It kind of help cut down.
I see little kids, and even in the grocery store during spring, with masks on.
I mean, you can wear a mask if you want, but really,
you're still breathing the air, right?
You're still, even in, you have the pollen. If you're not bald like me, you might have the pollen in your hair, and if you're a girl, it stick to your hair, and at night, you continue to breathe.
And just like it's on your car,
yes,
it's in your lungs like that, on your body.
It's your lungs, in your clothes. It's almost everywhere.
So basically, you need to pretty much drink something warm or hot.
Yes.
Clear your throat every day because it's there.
Yeah, shampoo your hair.
Yes.
Shampoo your hair. Definitely during the allergy season, I will suggest that you shampoo your hair more frequently. Make sure that you cover your pillow, and when you change your sheet as often as you can. You open your windows, then everything enter inside the house.
I sleep with my windows open.
Between your vent, your carpet.
Yes.
Also, everything stay there and is present everywhere you go.
Even in your car, your windows can be up, but coming through the vents.
Yes, to the vent.
Just look at your dashboard; it's there. And you have coughs like that forcefully.
Just talking about it, I'm having an allergic reaction.
Forcefully. Thank you for the tissue, ma'am. Thank you. But forcefully, you're going to need it. And it's there, and it's not very much you can do because it's on your shoes.
You track it in your house?
Yes. You like I said, even you put your AC, it's inside your vent. And that's why we say change your air filter. Mostly during allergy season, every 2 months.
Every time the season changes, you need to change those
every
filters.
3 months, that's what is recommended, but don't go more than 3 months. But if you have a lot of pollen and people are allergic in the house, change your air filter every 2 months.
And earlier I mentioned pollage. I kind of combine pollens and allergy together. It's pollage to me.
You have allergies that are mostly due during pollen season. It depends where you live. In the state of Georgia, you start very early in the month of February. If you go up north, it start later because winter is longer and spring start later. But in the state of Georgia, it really start early as February. So people know that they have allergic rhinitis because they have it the year before. They had it in 2 years. They have it almost every year. So really, don't say the answer is not to cut the trees, but the answer is really to start early, protecting yourself, changing your air filter, and also taking medication to help relieve those symptoms. Because what makes you miserable are the symptoms, and those coughing, this sneezing, this headache, this runny nose, your throat itching. You take your tongue always in the back of your throat, and it's not only your nose but also your eyes can be red, watery. So
Tongue in the back of your throat.
when
What
you
is that about?
irritation in the back of your
It's
throat.
dry.
Oh, irritation. Okay.
Yes.
Dry as if you swallowed sand.
Yes,
It's
and
like
you keep your tongue all the time in the back of your throat trying to clear it. But also the other things that you have that irritate your throat is what we call post-nasal drainage.
I just did that, and I just realized that my tongue goes back in the back of my throat when I clear my throat. Some things you're just not aware of when it happens.
Yes, and you have the post-nasal drainage too, when you have all the secretions, mostly at night, and they drain down your throat here, and that can irritate your throat.
And give you a stomach ache.
Yes.
So I'm aware of that.
So those are all the symptoms in between your nose, your ears. They can feel full. You're pulling your ears. It's itching. The other thing is your eyes being red, being watery, and you scratch your eyes all the time. So that can be also, all those are symptoms that make you miserable.
And this is a really busy season for emergency room and doctor's office because of that. And the little people, when I say little, I mean the infants, because sometimes parents don't know when they're taking the little people out there just for that little 5 or 10 minutes that pollen is on them, and they didn't pretty much didn't think about it's on the babies or other little people, and they forget to just wipe them down, including face-wise.
Yeah, I guess that would be the best thing to do after you've been outside, is to make sure that you wipe your face and wash up after you come up from outside.
Of course.
Yes. Absolutely. Because if you have to kind of decrease the exposure to the allergen, you have to really, if you can decrease that exposure, you cannot stop it, but you can decrease the exposure.
We don't always have to be allergic to different things. Is there something we can do to stop it? Is there a treatment? I know that I've worn out the Claritin and the...
Yeah, it's not a treatment by itself.
Right.
What people do, they do some tests. And you have different type of tests. You have the skin test, which is a little bit where they kind of inject through several
allergens.
And see how your skin react. That's probably one of the way to do it. But there is another way to do it where we're looking at your blood, and we can do the blood test. And in your blood test, they look at if you, what we call the immunoglobulin, if you really allergic to different type of component of the grass. They're looking at not only grass, but they're looking at food allergies. They're looking at if you allergies to danders, cats, and I mean, it's a very vast area where they can test what you're allergic to. So really, basically,
sometimes it may be your best friend, right?
Yes, yes, absolutely, absolutely, it can be your best friend. I don't know what you call best friend, but best friend can
be people.
No, I would say your best. I took best friend as your dog,
or your cat or fish at that moment.
Your cat also can be your best friend. So it depends what we call best friend, but we're not allergic to humans anyway.
We're not allergic to human beings.
No, I mean,
has that been proven?
I may have to beg the difference. I don't know. Sometimes some people can just really get to that spot in your nerves.
Yeah, that's it. That's what we call it, an irritation.
Just an irritation.
Yes.
Not an allergy.
Yeah, it's not an allergy, it's irritation.
Explaining the difference.
Yes. But like I said, you can do mostly the blood test to determine what you're allergic to. So if you know that what you're allergic to, you have different type of grass and trees. I will not suggest that you stop growing grass or cutting those trees because those trees are almost everywhere, and we need those trees anyway for us to breathe,
Yes.
shade,
Right.
and but really to take your medicine very early in the allergy season. Do not wait until you are fully blown to start taking your medicine. I would really suggest that months before that that allergy season is starting, let's say that February is starting, January, start taking your medicine.
Oh, okay.
So at
you
least-
have to build up.
Yeah, so
Right.
you build up because those medicine don't work overnight. Don't expect to take it and feel better the same day. It will take 2 to 3 weeks really to start working well. But
So now I
start.
understand why
Yes.
when I took my pill last night, it didn't work.
Yeah, continue to take
Because
it.
I have to take it for
Yeah.
a period of time.
Yes.
Yeah, take it every day, and take it during the entire allergy season. Take
Right.
it for at least the next 6 months.
And then if you have a yard, these trees you need to keep in mind: pine, oak, hackberry. I don't know what the hackberry tree is. Sweet gum and birch. Those are the trees that are really flaring up right now.
Oh, you just
So-
named Georgia.
I just named the whole state of Georgia.
Yes, you
oh,
did.
wait, I didn't name dogwoods.
You
I
did
have a
not,
dogwood.
because we know how beautiful dogwood can be.
We have a yard full of dogwood trees. And
So
no
beautiful.
problem. Or maple.
Yes, ma'am.
That would help too.
Yeah, but
And no grass.
no.
Artificial turf.
No. I will suggest that we continue to have nice grass, nice trees, but to really take a medicine early in the season and take it every day. Because you have two type of medication. You have what we call the antihistamine. They can be either in the nasal spray or as a pill. They can kind of help to decrease these allergic reaction, but you have to take it every day. And the good thing also is they're all over the counter. You don't need a prescription to get those medicine. One thing that sometimes those medicine can increase. I don't say drowsiness, but it's a possibility.
Yes. Even the non-drowsy formulas make me drowsy.
Yes, it's a possibility, but some are create less drowsiness than others. So you need to find which one works better for you. I don't want to give name, but if you go over the counter, you have plenty of pills available for those are antihistamine, and they can help for your symptoms. The other are what we call
The nasal spray?
the nasal spray. The nasal spray, some are antihistamine. They're not a steroid, but most of them are steroid. And what we said about the steroid is the one that works the best for if you have allergic rhinitis. But you can combine antihistamine and steroid at the same time. But the nasal spray, the steroid works well. It decreases inflammation, but also I recommend when you do it, before you do it, people don't pay attention to it. When we give these babies these nasal
Yes.
drops to clear their nose, and
First.
yes, you have to put it first, so you can clean your nose and remove all the pollen that's stick there during all day before you put your nasal spray.
What about a humidifier?
Yes, it's good. Humidifier are good because the nasal spray, mostly the steroid, can dry your nose
Right.
also. In some cases, you have some people that bleed after taking the nasal spray. That happen. So what you can do to help is put the saline drops first, so you can humidify your nose. The other things also put the corticosteroid, and take some ointment, the Vaseline, put it around your nose inside.
To keep it moist.
To keep it moist,
Okay.
so you can keep the moisture. And use humidifier also. That's good because the mostly with the AC.
Humidifier or dehumidifier?
No,
Up and down. It depends on the level of
it's
the house.
you want a humidifier because sometimes the air is dry with the AC, so that will help also keep, because you want some moisture.
To keep it moist.
Yeah, you want to keep it moist. Not you don't want to keep it dry.
Now, doctor, so how often should we use nasal spray, and how many times? It's too many times to squirt
Once a day.
in a day. Just once?
Once a day.
That's unusual. I don't know anybody that uses a nasal spray that doesn't squirt.
Because you're the
water.
first one. And I asked that because I know there's a danger to it, and there's a certain way you should hold it.
It's when you hold. I mean, now they change the formula of the medicine, because before it just come as a spray in one shot.
See, I'm going.
Okay, so it's one shot, and keep your head kind of a little bit down. The only reason why you have to keep your head a little bit down, because you don't want, if you keep your tilt your head backward, it just go down to your nose and straight, you can feel it down to your throat.
That's why I made this statement.
Yeah. So don't keep your ears and nose straight or a little bit down. And when you do it, you shoot inside and towards the middle. Sorry. When you shoot towards the middle, when you do it, you stop and you put your fingers around your nares and rub it. So when you rub it, it goes entire nasal mucosa. If you don't do it, you will just shoot it down to your throat. So now the new formula, the new nasal spray, it comes as a mist. So it's a
That's
nice,
much better.
yeah. It's a nice. It just comes as those
And
little
it
drops.
likes thin,
Yeah, it's
not a whoosh, squirt.
yeah. It's like droplets that comes nicely around your nose, and it seems to be more easier to absorb and more easier to kind of to take the medicine.
And it's better that we have the mist, because that's why a lot of people didn't use the nasal spray, because they felt as if they was drowning.
Yeah.
One, because they was doing it wrong, because they had their head back. So the moment it went in, it went straight down the throat.
Yes.
So you have to have your head tilted just a little bit, look as if you're writing. Mm-hmm. That's a great position to
Yes, absolutely.
illustrate as if you're writing.
And then
So
you gotta hold your nose so that it doesn't run back out.
Yes, it doesn't run back out, because you want the medicine to stay inside your nose.
right.
What about the shots that you can take?
Okay. The shots is to kind of help if you really have bad allergies.
Serious, yes.
Very serious and bad allergies that sometimes you probably need EpiPen with you. So that's at that time we can recommend for you to have the shot. What the shot does is just give you a small dose of the allergen, and so your body kind of build up and trying to become tolerant to the allergen. But it's for the large part. It's for very few group of few people, individuals that have really bad allergies and probably need an EpiPen. But for the general population, I will not suggest it.
Okay, but it is like it's more than an antihistamine. It's
Yes, it's let's say I'm going to give you an example. If you it's not this, like if you need a penicillin injection, and penicillin is a treatment like syphilis, and you are allergic to penicillin. So we have to give you very small dosage of penicillin so you can
Immune system.
so you can build your immune system so you don't have this allergy anymore. And then before you can get the full injection of penicillin. The other example, it's let's say peanut allergies. We say don't give peanut to kids less than 2-year-old.
2 to 3, yes.
Yes, they say don't give peanut, but in reality, some studies say we probably have to start very early, around age 1, giving peanut to these kids, because when you give them very small dosage of peanut at that time, they can kind of build up and be less allergic to peanut than if you wait age 2 trying to give them peanut.
So the pollen is not the only allergen. We have very many types of allergens that people
Yes.
cannot tolerate.
Yeah, because what we're talking about mostly here is allergic rhinitis, which is these particles that are in the air. But those are respiratory. But you have food allergy, you have medication allergy, you have anything that you can imagine, latex, anything you can imagine, you can have an allergy. You can be allergic to food, shrimp, lobster, peanut.
A lot of people are allergic to shellfish.
Shellfish, yes.
Why is that? Is it because of the iodine in it?
No, it's not that, but it's because they can still get iodine. No, but it's not the iodine. I don't know exactly what it is, but unfortunately, those shellfish have a lot of people.
High number of people who are allergic to it.
And the same with peanut or some other peanut. What else we have again?
I would say some people are allergic to chocolate. Just some. Not many.
Well,
just some.
I have a small chocolate attack.
Okay, so do I. Daily.
But I have to feed it. I have to feed my chocolate
daily.
The fact that I'm allergic to it, I feed it, and so maybe I'm not that allergic to it anymore.
Yeah.
Seafood, normally, like you say, shellfish normally is one of the biggest besides peanuts.
Yes.
And people who can eat fish still can't eat shellfish.
Yes. You can eat red snapper, you can eat bass, you can eat a lot of other fish, but shellfish is different.
Definitely different.
Yeah. Between lobster, crab, shrimp, oysters, it's a different kind of seafood.
I want to say seafood. Yes, because you have to be careful when you're out. Even though they're preparing your seafood, they think it's okay to use the same utensils.
I know some people who are so allergic to shellfish that they can't go to a restaurant where it's being prepared.
Yeah, just the smell sometimes.
Just the smell of it.
Yes, absolutely.
They'll close up their throat.
Right. I mean, deathly allergic to shellfish.
Yeah.
And they can't smell it on your breath if that's your husband or wife and you're close to them. It's really
absolutely
terrible.
Yeah. And those people need to have an EpiPen
at all times.
At all time, because things can happen very quickly.
Because they automatically shut down.
Now the EpiPens you have to have a prescription for, right?
Yes, you you have to. EpiPen. A few years ago, I don't know what's the cost. These days, it was affordable.
$600 to $700, and they was going up. They have it where
really?
Yes, ma'am.
Yeah,
and they have it where they're trying to bring it down.
Yeah, it's very expensive, like close to $600 one pen. And remember, when you're a kid, you need 2 pen because you need to keep one at school and one at home.
Correct.
Or when you walk around with your family
at all times.
And how much medicine is in one pen?
It's just one shot.
A dose. A dose.
One shot. That's it.
A dose. I mean, did you thought you was gonna year supply?
I thought it would be at least a month.
Hopefully you never have to use it, but you only get one dose.
You don't have to use it, but it's one dose. It's one shot. That's it.
We're gonna have to deal with that one, huh?
So
I've been dealing with it for a long time. And
that's the pharmaceutical end.
What was the question? Yes, you need. Most of the time, yes, you need a prescription to get it. And what was the other question again?
About the how many doses?
Yeah, it's just one.
And you're talking $600?
That was a guess, but it's a lot higher.
For one dose.
One dose.
What is shot is epinephrine. Epinephrine is a very old medicine that's been here for several years that we use most of the time for us in emergency medicine. In emergency medicine, when people have a problem with stop breathing,
and it's a life or death matter at that point.
Yeah. And really, to make the EpiPen, the epinephrine is not really expensive. It's really I believe. It's less than $1
talk about a markup.
It's just a markup, and I'm not going to go to the detail, but unfortunately, the price of medication in the U.S. has been higher than in any country in the world. Even if the medication has been discovered and made in the U.S., it costs more. It's more expensive in the U.S. than if you go across the border in Canada or across the Atlantic Ocean in Europe.
Well, I'm having a real problem with that cost. I mean, not that I need it, but I'm feeling the pain, the financial pain of others.
Yeah, if you have insurance, your insurance can cover it. But unfortunately, if you don't have insurance or if you have a copay, sometimes it can be difficult to pay for your EpiPen.
And just think about the little people I say little people, I always think of children, but think about people, period, that's allergic to bees that has to have that EpiPen.
We didn't mention that.
Yeah,
the allergic attacks from bees.
Yeah, those insect, yellow jacket.
Swell. If I get stung, I swell.
Mosquitoes and any insect you can have that allergic that reaction to a skin reaction, and it's more than a skin reaction. Then because after that, the next things your throat is swollen and it's difficult for you to breathe.
And you only have seconds.
Yeah, and
only
that's why
seconds.
And that's why your EpiPen is important to have it all the time. I mean, even kids that have EpiPen know how to inject it themselves. You don't need a doctor. You don't need a nurse. Anybody should be able to
jab.
I don't like the way you did that.
You just put it on your skin and press. That's all it is.
Quick jab. Prick.
Yeah. Yeah, you don't sometimes you just put it on your skin and just push, and that's it.
Really quick.
Yes. Anything that we sell has expiration date. The water that's in front of me has an expiration date. But the EpiPen, the expiration date is good. The EpiPen, when you buy it, is good for 1 year. I don't say the product expire. I'm not going to say anything about it. But the expiration date is 1 year. So if you go to school in August with your EpiPen, the nurse gave it back to you in May. Come back with a new EpiPen in August.
Now I have a question, Doctor. So even though we're not going to talk about the expiration date, is it possible that we can take the EpiPen back and trade it out with a price? Just a question.
No.
I mean, I knew that, but I wanted to ask for
a refill.
Well, exchange at least. But
no, because it's already expired.
Right. And I was asking for the listeners because a lot of people think it's okay to keep it forever and ever. Not saying that it won't work if you kept it 2 or 3 years, but who wants to take that chance?
Right.
You need it, and it's one of those uh-oh moments. So there's no trading it in, getting a new one?
No, there is none. You have to buy a new EpiPen every year.
Wow.
Yes.
And regardless of the cost, it's necessary.
Yes, it's you don't want to take a risk, and your life is more important than the $600 or $500, whatever. Say life has no cost, and you want to be protected. It's like driving your car. You need car insurance. You walk in the street, you need health insurance, and you need life insurance too at the same time. So because you don't want to take some risk. And
that's a big risk if you really have a serious allergic attack.
Yeah, if you have a serious, if your airway closed or was tied one time because you take either peanut or you were allergic to whatever it is, I will strongly recommend that you carry an EpiPen with you at all times.
And I would also strongly recommend to parents with kids that's, this season is here and they're going to be out for spring break or summer coming, you're going to a camp. It's important to fill out that medical part of that form. That's very, very important, especially when they're eating out, stopping at restaurants. Mm-hmm. If they don't have the EpiPen, don't take a chance and just ordering something because the kids say, "Ooh, I want it," knowing that it can cause a problem.
Right. Yeah. Even now in schools, you cannot bring any food that contains peanut product because they don't want to take the chance to have just one child being allergic to peanut and having problem.
Yeah, because that's serious. That can be really serious for some young person to go to camp or go to school and not have that information on their form. And so then the parent is actually relying on the child to say, I'm allergic to something. And not all the time will they admit that.
Right, because they want to be a child. They just want to have fun and they want to forget about it for a little while. And I'm not sure if the school allowed them to carry their EpiPen with them. Normally, medication stays with the nurse.
Not.
No, it's with the nurse.
It's with the nurse.
Yes.
And
I mean, for middle and school and elementary school. But I'm not sure. I have to verify for high school.
Okay.
But for middle school and elementary school, the nurse keep it.
EpiPen.
Yeah.
So nurses are now at schools every day now?
Yes.
I know they had kind of stepped away at one time, and so they're there. They don't just transfer.
I think that's very necessary.
Of course. Of course.
Quite necessary for the schools to have an on-duty nurse because somebody should be able to tell them what's going on.
Yes.
Even doctors, they should maybe have a doctor.
No.
Maybe a doctor on hand, If I'm sick, I want a doctor present.
No, not at this time.
He said, not at this time.
That's asking a bit too much, right? Okay. All right, then. So now, once a year, if we get the shot to protect you or build your immune system, if we do that...
No. The shot is not to build. It's a series of shots.
It's a series of shots.
Yes, it's a series of shots of the allergen, so you can what do you call it again? Desensitization. So you stop having this allergic reaction to that product. But it's a series of shots that you have to take. Yeah. But the other things that some people do also is they take corticosteroid by itself by mouth, or a shot of steroid also, kind of to help when these allergies are out of control. But like I said again, take your antihistamine every day and take your nasal corticosteroid every day. So you take your antihistamine once a day. You take your nasal spray, the corticosteroid once a day. Usually what I recommend is to take the nasal spray at night before you go to bed, and when you wake up, you take the antihistamine, the pill.
Okay.
So at least you cover during the day and night.
And only once a day.
It's once a day.
Yeah, and you want to start a month early.
Yeah, and start a month early. and don't quit after 1 month.
Usually, when people say steroids,
Right,
there's
because
a
we
big
were,
panic because of athletes and steroids. So, but it's okay to be prescribed a
Yes,
steroid.
this is locals. It's not something that go to your system. It's something that act locally inside your nose and to help decrease the inflammation and this reaction also. But it's not going to make you gain weight. It's not going to change. Yeah, sorry, it makes you gain weight.
We have opposite sentiments about that.
Doesn't make you gain weight. It doesn't steroid increase your blood sugar. That will not increase your blood sugar.
And a lot of steroids will do that, right?
Yes, if you take it by mouth. Yes, steroid retain what it does is increase your blood sugar and retain water. That's why people
swell up.
Get swollen when they take steroid.
Wow, but
no, it's if you use the correct technique.
As if you're writing.
see, you weren't here for our demonstration.
Yeah, you have to use
one spray with the head down.
Yeah, it's 1 or 2 spray
And massage them.
and massage.
Yeah,
Yes.
and massage your nose.
It's 1 or 2 spray, but you take it once
Once a day.
Yeah, you don't need to take it twice a day.
So no just pumping.
Well, that should help us deal with this season. That's this allergic season that's upon us now. Now, also, fall is also another big time
Yes.
season for
Absolutely,
allergies.
yes. Like I say, allergy can be, it's not just during the spring season. It can be also in autumn, fall season. So you have to know your body and know when these symptoms are triggered. But sometimes you have these symptoms all year for 12 months. So I would recommend it for 12 months, 365 days to take your medicine.
I hate being medicine dependent. Don't you?
You know, it's not being dependent to medicine. This is about lifestyle and how you want to be. If you want to be miserable,
That's a
which is
nice way.
fine,
That was so nice. Good.
don't take your
Thank you.
medicine, and that's fine. But if you want a quality of life, if you it's still spring and you still want to be outside, exercise, enjoy the weather, take your medicine and keep on going.
And
You
quit
should-
playing.
Yeah, keep playing. Don't stop and don't stay at home saying, "Oh,
I don't feel
pollen
well.
is here."
Quick
oh,
I don't
question.
feel well.
Yes.
I don't want to go
Quick question.
outside.
Pollen, these allergic reactions, can it be really, really dangerous if you don't treat it?
It's not like dangerous. It's just you're gonna feel very miserable to a point where remember if you continue to have those fluid buildup inside your nose, inside your sinuses, one of the other risks, if it stays there and nothing happen, it can be infected.
Right.
And that's why people have, after this being congested with this pollen and the sinus being built up with a lot of fluid, that sinus can be infected. And if it's infected, it can be infected by viruses, which is viral sinusitis, or it can be that you don't need antibiotics, you just need some supportive treatment. But if it's infected by bacteria, you probably will need to take antibiotics for 7 to 10 days.
So it's best to go ahead and treat the pollen now, because all this is connected. We don't want to go into the ears and to the throat, or we're in a little trouble.
Yeah. End up with
That's sneezing.
bronchitis just because you had
wheezing.
some
Yes.
allergic attack
Yes. So
or asthma.
yes, like I said, it can trigger your asthma. It can trigger make your eczema worse. So please go ahead and like I said, all this treatment is over the counter. You don't need to see a doctor. You don't need to see a nurse. These medication are over the counter. Just go ahead and take it.
And wash your hair often.
And your hands and your face, your
Yeah.
clothes,
Wipe
Just-
the kids off.
the linen,
Yeah.
you know, all of that.
Yes.
Well, thank you so much. We are going to switch gears when we come back. We're going to take a short break now, just to regroup and switch gears to colorectal cancer. So we'll be back. I'm Myrna Taylor Ransom. My guest today, Dr. Charles So and Miss Pamela, Nurse Pamela Davis. And we'll be right back after this short break.